I just come to visit my son, and I go up to the clinic, which is this big open clinic with people drilling on mercury fillings with no protection. They are putting mercury fillings in with no protection for anybody, because the mercury vapor, as you know, is a neurotoxin. And when you look at that, you go, how the heck can you do this? But the American Dental Association says that you have to put it in a very special way, because when it's transported across state lines, it's in a special container because it's toxic. When you mix it in the room, you got to have an open room with a lot of ventilation. You're not supposed to breathe it. And then they aren't supposed to touch it. They put it in something called, after it's mixed, an amalgam well. You take it and you put it, without touching it, into the patient's mouth, into the tooth. You pack it, you take the extra, you suck it up with that suction tip, and then they carve it off, and that's when they condense it, is the most mercury release that you're going to get, unless you're a hygienist. A hygienist polishes these things to make them nice and pretty, and they're releasing more mercury vapor in the air, and they're breathing this, and many of them have had miscarriages, by the way.
Really?
Way higher than the average American. And then once you're done, you take the extra, you put it in a glass container with a liquid, a fixer, and you dispose of it as hazardous waste. So according to the American Dental Association, the only safe place to store amalgam or mercury or silver fillings is in a human mouth.
How in the world? Okay, so why is there such a disconnect? I mean, I hear you tell this, and I'm just sitting there, and I'm thinking about my parents and all that my mom went through. I'm thinking about my dad. I'm thinking about me, how I had, after I met the Scaniers, I went and got all my amalgams out. Mm-hmm. And so, because, I heard about that, and it made sense. So where's the disconnect? How does this happen?
Well, if you take a look at who owns the patent, or was the last owner on the patent for mercury, American Dental Association.
Really?
Yeah, they were part of it. It was a financial thing. Did you know you used to endorse many, many products, and they say stamped with the seal of the American Dental Association? Well, people started asking questions. A gentleman who was one of my personal heroes, Hal Huggins, lost his license for saying that mercury was dangerous, but he developed MS as a result of taking out mercury fillings. And mercury sounds like many different other diseases that will occur. And so when we take out metals, mercury especially, out of people's mouths, it has to be done in a very specific way. You have to have a room that has ventilators, that have suction tips, that the patient and the staff has. We have respirators that we use, and the patient has a separate supply of oxygen. And we use a rubber dam so chunks don't go down person's mouth. We put the slow suction underneath because the rubber dam doesn't stop gases from going through. And then when we're done, we rinse their mouth. You can use chlora. We give our patients charcoal pills and liposomal vitamin C, which helps clean up the body. But then we refer them out to naturopaths and homeopathic physicians, MDHs, and we help each other. This is not a one-man show. I can't do without the support of a good group of people that I work with, over 50 different physicians in the Valley that refer me patients. And unfortunately, I can't refer everybody patients, but usually they're referred into me because they're sick. But that goes to the fact that everything that goes into your mouth goes through your body. And when you look at a person, let's say they have a heart attack, nitroglycerin underneath the tongue, bingo. Why? Because it's the most absorbable part of your body.
I've heard that, where you drop things underneath your tongue and it will hit you the fastest.
Yes, and it gets the fastest. That's why when you're taking mercury out, you want to use copious amounts of water, and you want to suck it out, and we use the extra saliva tip in there underneath to collect anything extra, because we don't want those vapors in your mouth. That's what's dangerous. And if you drink coffee and it goes over 110 degrees, which usually, it's easily, or it could be boiling hot, it's going to release a vapor every single time. Same thing when you chew. You chewing gum and you got a mouthful of mercury, you got a mouthful of vapor. But the whole point is each person has an individual genome. You look at it and you'll see how you do or how you don't do. You ask me, what am I looking for? You may not have any problem. People who have Alzheimer's disease, Parkinson's, probably could be an MTHFR, which is a genetic defect that you cannot process mercury and heavy metals. Others on chromosome number 19, you have a arginine setup, for one from the mom, one from the dad, or you have a cysteine setup, which loves mercury. It will grab the mercury, it will take it, you'll pee it out, or you poop it out. And then you have a combination of both, with a little less efficiency than if you have that. So it's actually a genetic thing. I know people that I think they could drink mercury and won't affect them. Other people,
Really?
Other people, so it's a genetic problem. This is all research done by Boyd Haley, who was the past chairman of chemistry at the University of Kentucky. And he actually developed a product that was called CRS. It's a new name today, that the FDA closed down. He made no claims. He sold it as a food supplement. And what it did was it helped autistic kids get better because it sucked the mercury out of the body. He has had clinical trials in South America at mercury mines on people who are exposed to mercury all the time.
Yeah.
And he's done some phenomenal work. And it's been shut down because people were making claims, not him. But these were parents who were trying to help other parents help their autistic children.